Hello guys, welcome back to my YouTube channel. This is pharmacist Sabir Bagban. Guys, our today's topic is diabetes. Today we will discuss about the causes of diabetes, symptoms of diabetic patient, various detection tests that are used for the detection of diabetes, and the last one is management of diabetes, in which we will discuss about the various lifestyle changes, lifestyle tips for management of diabetes, and various medication which are provided by our doctor routinely to treat and manage the condition of diabetes. So guys, this video will be slightly longer, so I will divide it in three parts for your convenience. In first part, we will discuss about the causes and symptoms. In the second part, we will discuss various blood tests and urine tests that are used to detect the condition. And in the last part, we will discuss about the management. In that part, we will discuss various lifestyle changes and the various medication which are provided or prescribed by our physician and our doctor. So let's start our first part. First of all, causes of diabetes. Guys, I want to give you an example to let you all clear the condition. Let you all be able to clear the condition which involve the procedure, all the procedure, that why the diabetes is causes. What are the main causes why the diabetic problem is occur in our body? So first of all, assume a cell. Now assume that this is a body cell, but assume that it is as a room. Okay. Now we all know that the room has a door, and there is a person standing outside the room at the door named glucose. So the person glucose wanted to go inside the room, but the door is locked. Now we need a key to open the lock and to go inside the room. Now the name of the key is insulin. But if glucose found a key insulin, then he or she will open the door and will go inside the room. Now what is insulin, what is glucose, and what is cell? So let's understand it one by one. Cell is our body cell, and insulin is a hormone. Guys, insulin is a hormone which are produced by our organ, our body's organ called pancreas. Pancreas is an organ in our body around the intestine which produces insulin, and this insulin is responsible to open the lock. Means this insulin is responsible to allow the cell to uptake the glucose inside it. Now what is the function of glucose and from where we get it? Guys, the food we eat, we get glucose from it, and glucose is really very necessary and important for the various energy, to getting energy for various bodily functions. So now in diabetic patient what happen? So let's understand. First of all, if the pancreas is unable to produce insulin, that simply means the key is not getting in the hand of glucose. The person glucose is not getting the key. So the door will not open and the glucose person will not be able to enter the room, enter the cell. Now in the second condition, like suppose pancreas is producing insulin, that means the person glucose get the key, but now the lock on the door is damaged. So yeah, glucose has key, but the lock is damaged, so the key is unable to open the damaged lock. Now the door will remain closed, so glucose will not be able to enter the cell, enter the room. So what will be the result? The result will be same. The glucose will be outside the room. Glucose will not get into the room. So many glucose person will accumulate outside in the blood. That is the reason why the diabetic person has lots of amount of glucose, more amount of glucose in the blood. So this is the condition, insulin resistant condition. Either the insulin is not produced by the pancreas, or insulin is produced but the cell is resistant to insulin, so the cell is unable to use insulins to uptake the glucose inside in it. So this is the causes of diabetes, and this will lead to the rise of blood glucose and that will result in the diabetic condition. So these are the causes of diabetes. Now the second part is symptoms of diabetes. In this part we will discuss about the symptoms, various symptoms a diabetic patient may face. The first one is increased thirst and hunger. That simply means a diabetic patient will have more thirst, will feel more thirsty again and again, and will feel more hungry again and again. The reason is clear, because yeah, there is glucose in the blood, but the cell is unable to uptake it, so it will require more and more glucose, and that's why the person will feel to eat more and more and will feel hungry always and thirsty always. Now the second one is urination, frequent urination. It is most simple that if we drink more and more water, then we will feel frequent urination. The urge for urination will definitely increases, so we will visit more and more time washrooms. Third one is weight loss. Yeah, that's again clear that our body cell is unable to get energy, so our body weight will be lost. The last one is fatigue. Fatigue, that means weakness, and it's again simple that we don't get enough energy, so we will definitely feel fatigue and tiredness, and the chances of infection getting infection is will be higher. So these are the causes and symptoms of diabetes. This is the first part. Now we will continue our video in next part, that will be about various detection tests, various diagnostic tests that are used for the detection of diabetes. So we will see it in the next part. Thank you very much.